Hello, it's Brian Multy, Executive Director of the Hope and Heal Fund. Just wanted to welcome you all to the webinar today. So we'll go a little bit more detail in just a second. Just want to remind everybody that this session will be recorded and welcome again. And Saul, I'll turn it over to you.
Thank you, Brian. Thank you, everybody who is joining us, as well as those of you who might be reviewing the recording at a later time. Thank you for joining us today. We have a lot of information to cover in a very short amount of time. Once we will make our contact information available to you all after the webinar, so that you can reach out to us with any additional questions or comments. We do want to remind you there is a Q&A section. If you have questions, you can submit them through there, and then we'll address them as we're going through the webinar. But I want to welcome you to this exciting point for Hope and Heal Fund, where we are introducing to you our new tool guide on what firearm violence prevention is for community-based organizations and what that looks like. But also, we want to acknowledge there's many people, right, that are part of this work, many people doing the work, as well, including those that might be gun owners, firearm owners, as well as those that are not, those that are doing the work, and families and community. And so I just want to acknowledge everyone from that is part of this work or is connected to this topic in one way or another. This tool guide is put together with that in mind, of including being inclusive and bringing everyone to the table. And so what you will hear in a second as we start our PowerPoint presentation is the framework of what firearm violence prevention is, and all the details that it encompasses, not just what you might see in the news or your approaches, but also everything else. And so to define that, I want to be very intentional in sharing that we are looking at community violence, we're looking at intimate partner violence, we're looking at suicides, as well as mass shootings, and everything that falls within those, in between those categories, as well as part of this conversation on how to prevent firearms or what the work looks like. And that is a wide range of activities for community-based organizations. Some people might be doing intervention, some people might be doing prevention, others might be doing aftercare, others might be doing narrative change or data, and everyone plays a role into the ecosystem of firearm violence prevention, both in local communities, statewide, and even internationally, as this continues to affect communities. I do want to acknowledge that for Hope and Heal, we start with an equity lens. It's not after the fact. All of our work is intentional in addressing equities and inequities in communities, as we know that this effect can have different impacts on resolving and the prevention of loss of life in various communities. And so with that, I want to introduce Cuco Rodriguez, who is our chief strategist, to start us off in the conversation of this tool guide that was developed to help people understand what firearm violence prevention looks like and is.
Thank you. And again, let's keep in mind that, part of the intent, what we want to do with this tool guide is that there's a lot of organizations that might be focused on gun aspects of gun violence work. And then there's others that this isn't part of the work that they do. We've kind of created this, and what you'll see today is it's more of an opportunity for people to understand the need to incorporate this, especially for, again, community or based organizations, grassroots organizations working in impacted low-income communities. This is not a issue that is no longer affecting a couple of communities. This is now, again, there's no community that is immune to gun violence issues. And so what we did is we created this so that folks can have an opportunity to understand the full landscape of gun violence and the impact that it's having, some of the contributing factors. And then at the end, what we're going to talk about is some practical suggestions or recommendations for community-based organizations that I think can integrate into their work to address some of these issues. And as we'll walk through the factors, again, we kind of look at it from a system standpoint, but that's kind of what you're going to see today. And again, our hope is that at the back end, you'll begin to see some of the practical things that community organizations can do to curb gun violence in your community.
I was sharing a little bit about Hope and Heal Fund and our work and our interest in doing this work. I was backing up to share that we are a philanthropic organization supporting communities throughout California in addressing the loss of life due to firearm violence. And with that, do want to acknowledge the race and equity considerations and implications of what that means. This tool guide was put together to help you all or help us all understand the different roles that different organizations in California play into firearm violence prevention. Um, we do want to point out race inequity and racism cannot be ignored in this work. And for us, that means many different things. One, while policy is very important, it also doesn't always translate to supporting communities. And so for us, we're mindful of that and understand that change, while policy is important, change also comes at the community level because of these equity implications that have on BIPOC communities. Um, in the practical part of that is what is the access of guns in low income communities as well as neglected communities, and how are some communities affected by others, and what does the data tell us about these implications in considering the implications of firearm violence throughout communities in California, especially those communities that are underinvested by philanthropy, um, or the perceptions that exist, the narratives that exist. We get calls constantly from various communities that are dealing with firearm violence from different points, right? Some are dealing with challenges of narratives, conflicting narratives, or competition in narratives. Others are underfunded or not having access to resources. And we'll share a little bit more once we get into the data piece of this. But we really wanted to be intentional where communities fit into the whole ecosystem of firearm violence prevention. Kuko, is there anything you want to add to the race and equity considerations?
No, I mean, I think that you know what, and we'll send you a copy of this. This is important to us because this is really what guides our work in terms of, ignoring racism is not something that we can afford in this work, because it is really the root cause of a lot of what we're seeing. And it's important for us because sometimes I think people want to take a snapshot of what's going on in communities as if this occurred in a vacuum, and it is not. So that's a big part of what guides our work. Certainly in the gun violence field, there isn't a lot of inequality in how we're addressing it, how we're distributing resources, how we look at the issue. So that's something that we try to bring into this conversation. And again, another pillar that helps guide our work. Trauma and healing, again, is a big part of the work that we do. We also believe that all gun violence is interconnected. It's not just homicides on one side, suicides, and certain populations. It's all very interconnected. The other part of it is that, we firmly believe that all life is sacred, and we should respond equitably to that, in terms of resources, in terms of empathy. But what we unfortunately see is responses that I think bear out that there is a false hierarchy of human value, where darker lives are valued much less in the way that we respond and the way that we resource. We also, again, believe that one of the guiding principles is that access is one of the areas that's really neglected. Why are guns available in certain communities and accessible to young people? Why are they not in others? And then the last piece that we look at as part of our strategy work and that guides our work in terms of solutions is we really try to create some dissonance, really to point out, especially on issues of inequality, why we respond a certain way to when white communities are impacted, and then we don't respond accordingly with other communities of color are impacted as well, and they're not resourced.
Thank you, Kuko. One of the things that I was sharing, I don't know if with the audio dropouts, people were able to catch, is that with race and equity, I think for us at Hope and Heal, it's very important to set it at the front of the conversation, and we're very intentional. We work with communities to share that, because in a lot of processes throughout the state or the nation, sometimes it's after the fact that the discussion of equity comes into the room, and that is the final result of what that intervention work looks very different when you're intentional with equity versus when it's added on after things have already been built or conversations have been had in community. With that, I want to share with you the Hope and Heal Fund framework to firearm violence prevention. These are the parts for firearm violence prevention, which are prevention, intervention, aftercare, gun proliferation, the cost of homicides and suicides, and trauma and healing. Um, these are all very important tools. In the prevention piece, what does that mean for communities to prevent versus dealing with after the fact? Google and I just spent 3 days with the National Compadres Network working with a group of people who have started a fellowship for people in the CVI field. And one of the things that for me, this is what I captured from that conversation this week is the fact that some of the work in CBI sometimes is responsive. It's after a shooting has happened. It's after there's violence, and so we're going to be talking about all the elements as to really that's an important piece, but also how do you prevent it rather than deal with it once, right? I think that's the goal is to the prevention piece. And then getting to the intervention piece is if there's already been violence, how do you prevent the rest, the continuation of violence, the back and forth? But also, in the prevention and intervention, it's not just community violence, it's also suicides. It's also the mental health community. What are the opportunities and the tools for everybody working in different pieces, whether we're talking community, suicides, intimate partner violence, the prevention, the intervention points, and the aftercare. If incidents already happen, what are those opportunities to connect people to resources, to work with them? And then the gun proliferation. Where are the guns coming from? Why is there access? Why do some communities have more flow of guns into those communities? And who's doing the work to address what that looks like or to prevent the gun proliferation in some communities? The cost of gun homicides and suicides. That's very important of how much tax dollars and resources are going into addressing homicides and suicides, and how much of those dollars really we could have used for prevention uh, work as well. And then the last one in this slide, the trauma and healing, very important part that also gets left out of the conversation in the larger firearm violence prevention conversation. What do communities need? And when looking at equity, what do specific communities need that's culturally appropriate for those communities? And so all of you who are here today or tuning in or hearing the recording, what is that role? You all work in different parts of organizations, but this is part of fire and violence prevention that you all play a role into this, whether it's the trauma and healing, the prevention piece, the intervention, the aftercare, or even the data tracking, which we're going to talk about in a second. Kuko.
Yeah, and the reason we want to cover the framework is it seems very simplistic, but it's important because we want to categorize in communities the work that you're developing that's comprehensive. We feel that these are all areas that create a comprehensive plan that's sustainable. And it's important to look at prevention, intervention, and aftercare as the most basic components, because what we see is that in every community across the country is that the investments that are made around gun violence are through law enforcement. And we're very clear that that does very little prevention and very little aftercare. It is an intervention, and it only occurs after somebody dies or somebody gets shot. And so as a consequence, that's very connected to the cost piece. It's very expensive in terms of investing in just an intervention that really, as you increase the funding for that, it becomes 2 officers, 3 officers, 4 officers responding to one homicide to investigate a homicide. But you've put very little in resources on prevention and the aftermath of what occurs. Point being, it's important to categorize what we're investing in to understand what it is that we're trying to address. There's very little to decrease it. And yes, especially when you look at the cost in terms of just investigative costs that are associated with every homicide that occurs in communities, but then the clearance rate, which is the number of cases that are solved in those situations. So not only are we investing a considerable amount of money in the investigative piece, but we're also not solving a whole lot. So um, these are all important components because it's also important to place what we're resourcing, what we have in communities, what we don't have. There's some communities that only have, let's say, CBI work. That's an intervention. What are we investing in terms of prevention and aftercare? And again, are we looking at some of these other factors like how guns are getting into communities? The expense piece is important because that affords organizations an opportunity to question policymakers and electeds in terms of how we're investing and whether or not it's working. And the last part is the trauma and healing piece is really critical because it's a big component that's left out of this equation typically in gun violence work. And while access to firearms is very, very critical, um, the root cause of it is the normalization of taking of life. We have so normalized the loss of life and taking of life that it is very normal and accepted for many folks in communities to believe that the way that they resolve internal conflict or external conflict is by taking their own life or the life of others, and that's not normal. That is not normal, and we need to really contextualize that and do a lot of work around that in terms of trauma and healing work um because it, it really needs to be taken out of the table. It needs to be included as part of the strategy across the board in prevention, intervention, and aftercare is really beginning to move away from that mindset that is a normal response, again, to dehumanize self and others, where you feel that it's okay and it's on the table to take somebody's life if they've offended you. Moreover, we're seeing in a lot of cases of homicides right now, what that's looking like is actually beef and Facebook postings. It is not the way that it used to look 20 years ago. A lot of conflict that's being that is creating a lot of tension in communities is actually over social media. So again, that healing and trauma is really, really, really critical, important. But the framework is important so that we understand the work that's needed across the board in a comprehensive way.
And if we didn't make it clear, I want to be very intentional and clear that it's not one organization or one in a community doing this work. It's really the entire community that needs to invest, or different partners to invest and figuring out what is needed for that community and in those parts.
Every organization is part of the solution, but they're not just the only solution. It has to be a partnership with a lot of folks that are doing a variety of different work. And so the prevention, intervention, and aftercare components become really critical to see if that's what we have. Also, if that's where we're investing. And the next part of what we're going to walk through is some of the data, because I think that it begins to build on the strategy for folks to look at in terms of what is it that we're investing in, and then is it in the right places? Is it in communities that are being impacted? And then what the data looks like. Some of you may be familiar with this data, but others may not. But it's important data points to review because of the impact that it's having in communities overall, nationally. And then I'm going to look at some of the California data as well.
So really quick, some of the data on here. What we see in the news is mostly the mass shootings, and that only accounts for 1% of gun deaths in the nation. And so want to be very intentional about those data points and what not just we all are hearing, but what our communities are hearing. Firearm deaths are the leading cause of children from 1 through 19 per CDC data. And yet, how often do we hear that every day, that that's the leading cause of people ages 1 to 19? 54% of all gun-related deaths in the U.S. were suicide. More than half of those are of all deaths are suicides, and that is also in California the case for California and for um, counties. Now, some counties might have different rates and throughout California, but that's pretty much the way it breaks down. 43% were murders. There's also law enforcement, murder by or homicide by law enforcement involving a gun, and as well as undetermined circumstances. Um, eight in 10 murders in 2020 involved the firearm, and I think that's a very important time and date as the pandemic was happening. We could share more data that we've collected from that time period during the lockdown and COVID. In 2020, 45,000 people died from gun-related injuries. That is a very high number of people that have died. In California, in a 10-year span, we had 14,000 people die from homicides. That's not accounting for suicides as well. And we'll talk more about data. These are just some national data trends. There were 19 homicides in 2020, with African Americans accounting for 62% and a total of 21% for the white community. 4,100 Latinx people died from gun violence in the United States, and approximately two-thirds are homicides. With this national data, we also want to, bring into question the intimate partner violence data and the gender-based violence data that's not in this table here, because we're also mindful of those different dynamics. Google, do you want to add to the national data conversation?
Yeah, no, we'll go straight through because we want to get to the back end of it. I'm trying to be mindful of time here as well. Folks have any questions as we're moving through this, please feel free to kind of put it in the chat, and then we'll try to respond as we're going through. Some of the mortality, some of the data in when we look at kind of LA County specifically, and the US as well as California, is between 2019 2021, the mortality rates increased in the US by 23%, 25% in the US, and LA County jumped like 46%. So you see significant increases in California alone, what we've seen in the last several years. In terms of LA County, injury by intent, 3 out of every 5 firearm deaths were a homicide. This is again LA County. This also includes unincorporated areas of LA, right? Over 1/3 of firearm deaths were suicides. Other firearm deaths include intentional shootings, legal interventions, again, law enforcement deaths, and deaths that were there were also some deaths that could not be determined in LA County. And in the US, 56% of firearm deaths were suicides, as you know, and as Saul was stating earlier. In terms of
sorry to interrupt. Do you want to go back to the last slide and speak about the desegregation of data with intimate partner violence in the?
We will. I will in later slides.
Okay, thank you.
Yeah. In terms of the homicide rates by race and ethnicity, these are kind of 91% were male, 58% were under the age of 35. 92% in terms of that was in terms of homicides. In terms of suicide rates, 92% were male, 43% were age 55 and older, 1.6% Asian, Black 4.5, Latinx 1.5, white 7.4 in terms of the rates. And again, this is just the LA County for 2022. Again, LA County for 2022, 313 suicides, 19 hospitalized suicides attempts for self-harm. And this is an interesting slide because when we talk a little bit about cost, LA County does have a really good system of categorizing some of this, and what they came up with in terms of total cost for emergency transport, Medi-Cal or healthcare, mental health care, police response. I mean, you can see that's a $4.5 million just a police response. They didn't include the criminal justice system in terms of, so this number would actually be much higher. Employee losses, work losses, and then quality of life costs. So their total number in LA is like 4.2 billion is what they come up with in terms of, the collective impact of having firearm suicide deaths and injury. This is suicides. Some of the other stats in terms of suicides, again, well, let me skip through this here. Let's jump into some of the other data around GIS mapping, because I think this is important. And it's something that we wanting to afford participants, because I think it's an important part of the work, especially when we talk about communities that are being impacted that perhaps typically are not included in larger data sweeps like that are at a county level or such. We began our work with this map. Hopefully you all can see us. And part of the reason we developed this map was to ensure that communities and folks across the state understood that although LA, although large urban centers do have high rates of homicides, firearm related homicides, more than half were actually in urban and in non-urban. They were rural, suburban communities. That is really more than half, and especially when you start looking at a lot of small rural communities in the Central Valley. Literally from, you can go from the top of California down the Central Valley all the way to Imperial, and it is these smaller communities. Of course, it also includes Fresno, Modesto, but then there's also these other smaller communities like Delano and Lompoc that have 40,000 people, 20,000 people, and per capita have super high rates. So we created this map to make sure that folks really understood that, and we'll include this in an email to everybody as a resource. As you can see, you can kind of zoom in down, like here's Stockton, down to the street level in terms of every homicide that's occurred from 2014 to 2022 down to the street level. And this is important because some of these communities don't have access to this information by city. They might have them by county. But more importantly, we wanted to really illustrate that there are a lot of areas that are under-resourced that are being impacted by gun violence. The other map that we created that I think is important to share is our gun homicide. Let me
Suicide.
move it up here real quick. Suicide, and give me 1 second here. Can you see that? So,
Yes.
okay. So this is a combined map when we look at firearm homicides and suicides, because again, gun violence is interconnected. And while our focus really has been for a long time looking at gun-related homicides, suicides also contribute to about half of total deaths in California. And it varies by community. So that's one of the reasons we wanted to do this. So when you look at, I think it was Humboldt, yes, Humboldt County. Humboldt, you look at their firearm suicide rate was 93, 9.8 per 100,000. The state average is 2.9. And then when you look at their firearm homicide rate, it's 6.5. The state average is 3.8. Humboldt becomes one of the highest counties that's impacted by firearm violence per capita because there's not a lot of people there compared to, when you look at LA County, LA County, their suicide rate is firearm suicide rate is 2.8. It's lower than the state average at 2.9. However, their homicide rate for LA County as a whole is 4.9 compared to 3.8 at the state level. So again, per capita, what we've done, the reason this data is important is we've so normalized the loss of life in small communities that we think, well, 3 people that died, but the community is really tiny. It actually is a super high rate. And again, we'll get into some of the factors that contribute to this because it builds on this data as well. And that's that's a very, very important component of this because, for us, the implications of these maps helped us address really very false narratives about where firearm violence is occurring. Because for a long time, the perception was, well, it's LA, it's San Francisco, it's Oakland. And in reality, with the data showing that's not the case, that has significant implications for a lot of our partners who fund this work. And the data now is showing like what investments do we have in those particular areas. Now, when you come down to the city or the county level and some of the work that you do, this data becomes very important because you are able to look at your rates, but you're also able to look at what are we investing in these things? Where are we investing? Because if, like in San Diego, San Diego is one of the safest counties in the state, unless you live in Barrio Logan. Barrio Logan has a super high rate, so in a like 2 mile radius, you see the concentration of homicides. And San Diego also is investing resources to address the issue. And so with the data, we're able to see where the investments are. And guess what? They're not in Barrio Logan. So the data from a standpoint of community-based organizations becomes very helpful for you to look at that, because it helps you be strategic about your investments and also question whether or not the investments are going to the right places to address the issue of gun violence. The other implications of these maps is that this is something that Saul brought up earlier. We are missing, when you look at the homicide data, firearm-related homicide data, there is missing data related to intimate partner violence. So when we showed that map, you looked at your community, most of us assume that firearm homicides are gang-related, street violence, that kind of, they're all related to that. And that is maybe true. However, there is a significant number in some communities, significant number of those are intimate partner violence homicides. And the data has not been made available. Law enforcement has withheld a great deal or not reported a lot of that data. And that's a really critical data point, primarily because if, let's say 20%, we do have data from 2 counties, Orange County and Sacramento. Orange County accounted 20% of their total gun-related homicides were intimate partner violence. So that means that the implications is that if you don't disaggregate that in a community, then what you're doing is you might be undermining the work that community violence interruption workers are doing to decrease, let's say, gang homicides. And what happens, and why this is important, is because it also robs women and IPV services of needed resources because it's not being reported. But it also, and again, as I said, it also undermines the success of CVI work. And more importantly, disclosure of this data is important because we can clarify really what's going on in communities and narratives that are created. But what's really critical, I think, to community-based organizations in this area is that when law enforcement comes in to ask for resources because there's been an increase in homicides, the second question for us or for folks that are elected should be, how many of those homicides were intimate partner violence? And if that number comes back at 30 or 40%, then what might result is that we actually have seen a decrease in community violence, but we're seeing an increase or no change in intimate partner violence. And that means that, one, we need to provide more resources to that, and also question why law enforcement is asking for more money when the increase has not been in community violence, it has been in intimate partner violence, and they have no net effect on any preventative aspect of that whatsoever. So this becomes a really important base to build on in terms of having the data, and that we want to encourage organizations to look at, because the disaggregation of that information is really critically important. As I said before, the implications of this kind of data and maps also, it identifies like, where are we investing geographically? Where do we need to invest? If you have the right data points, you can almost find that between certain times and certain times a year and certain locations have high impact. As you saw in those maps, there were dots over dots over dots, which means there were places where people were shot over the years in similar vicinities. So it's very helpful to help develop what interventions, or at least to try to understand what's going on in some of these communities. It also raises some questions about equity. In many of the communities that we're talking about in the Central Valley, you're talking about a proportionality of 90%, 80% of the communities are Latinos, and we have no investments in those areas. And 100% of the deaths that are in those communities are also Latino. So while the distribution of resources or the total firearm-related homicides might look equitable at the state level, when we go down to these communities and look at these small communities and there's no investments there, it does raise some questions about equity and how we're addressing the issue. And again, like I said, the last thing is it also challenges law enforcement and the narratives that they create with the data that they have, and also challenges the notion of why they're not releasing data that is not in the best interest of the community. Anything else you want to add, Saul?
Yeah, I was going to add that this data is not easily accessible for communities, and that is why we also mapped it to make it available and included part of this tool guide. Because, but we, if you are interested in your local data, we can help you figure out how to source that data or how to access that data. Because it's important to know what the numbers tell you about your community or the communities that you're working with, and so finding out what that data looks like. We have a few ways of supporting community and finding that. And so just wanted to make that point because some people might feel overwhelming, like, well, I don't even know where to start or access that data, but we can support in that work.
So now we get to some of the considerations in terms of for folks to look at in terms of the work that you're doing. And the things that are manageable. We get that a lot of you already in your organizations are doing a lot. This may be something that, again, you currently work on in your organization, or maybe not. But there are some very manageable things that organizations can do to support the work. But more importantly, I for a lot of community-based organizations, we are built on the fact that there's a need in a community. And I've yet to see a community, especially a community of color, in need of, let's say, healthcare, immigration, all these other things that are associated with poverty, where it includes all of that and it doesn't include gun violence. So these are intended to kind of have you kind of look at a different way of looking at the issue and factors that we can contain and control to address and manage, or try to ameliorate the issue of gun violence, but also for your organizations to begin to challenge yourselves to see how much work you're doing in that area, or whether there's certain aspects that you can support and to address it if it's not part of the compendium of services that you're looking at. And again, these are intended for some kind of next steps and considerations for folks. We come at it from a systems kind of standpoint. So we're going to kind of give you the takeaways that we think are some critical areas. One, again, disaggregation of data, as we talked about. More than happy to provide for you, and hope that you use the maps that we provided, because it's helpful for your community to look at that. But we also encourage you to look at accessing local data. Maps that you saw, that's something like 30,000 data entries. That's a lot of entries that we have to put into the map. In your community, it may be 50. That's a lot more manageable. The data, it might be more accessible if you're a community member or a community-based organization. More than happy to work with you on developing strategies to submit Freedom of Information Acts, or we might have the data through other venues. But the data is important. Disaggregating the data, like I said, is really critical, because the intimate partner violence data is really important, especially in communities. We were in Delano, for example. They spent 60% of their budget on law enforcement. And the total homicide rate was like 10 in certain years. But they were presenting it as if it was all kind of gang related, right? So again, the question of how much of that is intimate partner violence, it should be raised in communities, because then I think it undermines really the argument that we need more law enforcement response to address, this gun violence. Well, the assumption again being, the racist assumption being, that it's all gang related, that it's all associated with that. And again, it leaves out the IPV data. But any type of disaggregation of this information would be very helpful, because it gives you insight in terms of how to guide the work and what to address. We also ask people, I'm going to give you some examples that you can look at, and you can feel free to call us as well. We try to use create comparative analysis in terms of the work that we're doing. And what that means is, look at existing strategies or plans that address loss of life or other things that are working within systems. As an advocate, I really hate systems like county structures, government systems, because they haven't worked for my community. But as a systems strategist, as an engineer in my prior life, what I appreciate about systems is that they outlive everybody. They continue to move forward regardless of who's in leadership. They continue, and I say that it's as an important point, because that means that if you change a system that works and addresses the needs that you have, that can be something that's sustainable. And in part of that is that the system is also working for some folks It's just not working for others. And so the comparative analysis is important when you find things that are working really well for one community, and it helps you raise the question. I talked about dissonance, to say, well, why are we doing it here and why are we not doing it here? And sometimes it requires you to step back and look at that. But so I'm going to give you some examples of what we use as a comparative analysis to help us bolster arguments around the need for resources to address the issue of gun violence. One is the emergency operation plan for fire. Most of your counties probably have that. In Santa Barbara County, where Saul and I used to work, it is a very robust plan that's funded heavily, and it's to make sure that there is, one, there are no wildfires, and two, it's really, I mean, fundamentally to make sure that people living less than 1% of the population, 2% of the population, living on the most expensive property in the country don't lose their homes or lose their lives. And that is robustly funded. And every year, I think no one has died of a fire, wildfire in Santa Barbara County, like in 40 or 50 years, other than maybe a firefighter or two who have died throughout the years. But in terms of residents, so that's an example of an existing strategy within a large system that's working. And so for us, what we did is we're more than happy to share this with you again as part of the resource guide, a template of a emergency operations plan for firearms. So you have an example of a strategy that's working. Nobody's died. I would argue from an equity standpoint that it represents a very small fraction of the population who happen to be the richest in Santa Barbara County if they're living on that Riviera. And yet in Santa Barbara County in the last 10 years, no less than 23 people have died of firearm violence on an annual basis, and we have no plan. So we use the EOP, Emergency Operations Plan for Fire, as a argument saying you have an existing strategy that's working very well. We would love to see that from an equitable standpoint applied to other communities and developing a plan similarly so that we can address gun violence in a similar fashion with similar investments that represent not 2% of the population, that represents 50% of the population. At the end of the day, it also, I think, is important to note that when you look at that kind of disparities in terms of the percent of the population that's impacted by wildfires, who gets this resource and gets this planning, this coordination, all of these things, we really need to question who's subsidizing what, because that 2% is not paying for the amount of resources that go to ensure that there are no fires. It's very expensive. In like manner, why is it that 40% of the population is not receiving similar services to ensure that their kids are not dying at high rates? Also would urge you to look at other strategic plans in counties or cities, plans on homelessness. Again, the focus of homelessness, reducing homelessness is really, that's a very vulnerable population that loses their lives at very high rates. And therefore we develop these plans as we should. In like manner, we are losing more young people in some communities than any other population due to gun violence, and yet we have no plans. So again, think about it in those contexts in terms of creating comparative analysis and also a dissonance in terms of equity. Why is it that we're responding this way? Why is it that we respond differently? Where this comes from is the fact that in Santa Barbara County, when the Isla Vista shooting occurred, every resource was thrown at that, as it should be. We saw that, I tell people I lived in, was working in that area. You saw the best thing in people, the best thing in systems. Nobody said, hey, it's not my job. Everybody attended to that need as they should. But the real question is, when there was a shooting on the west side, why didn't we respond in that way? West side would be where a lot of Latinos live in Santa Barbara County, or the east side, either place. So anyways, doing a comparative analysis and looking at the behaviors and how we respond is important for us to look at and advocate for services. The last thing is that I'll leave you with is a comparative example is that, and I hesitate to use this, but I use it because I usually get pushback, and this is what I have in my back pocket, is that at the end of the day, most communities, most counties especially, spend more money on the well-being of cats and dogs through animal shelters than they do the well-being of Black and brown youth who are losing their lives in most communities, that's what you see. I think Riverside, San Bernardino County, some of these counties are spending like $20 million, have 30 staff that do kind of animal shelter, animal control, different things. And yet we have no services for gun violence reduction or loss of life in that area. The next item that I think is important for folks to consider as a strategy is, again, as we talked about a little bit ago, the cost of investigation and clearance rates. We spend a lot of money on investigating homicides specifically, and the clearance rate is very low. So it does raise the question, how effective is this if we're spending so much money to investigate, and at the end of the day, we're really not solving a lot of this. So that's an important point to make, because it really is. It really speaks to the issue of competency. We have a particular problem that we've been trying to resolve with it's a nail. It's not a nail. We are trying to solve it with a hammer, and it's not working, and we're not getting results. And so, does it make sense in terms of from a competency, in terms of incompetence? Do we want to continue investing in something that's not working, and we're also not getting the results? And it also helps us bolster the argument that really a fraction of that investment going to prevention could really help reduce the rates in a much more cost-effective way than what we've been doing. Because what we've been doing, there is data. I'm sure you can look at that in your own community, whether or not it's working or not. But you also can begin to ask the question of how expensive is it? How much is our community spending on investigating each homicide? And that's something that any organization can do at any city council, and request that information from the city council people, the mayor, so that you have an actual number. And then you just multiply that by the number of deaths, and you realize that, wow, we're spending $1 million, $2 million, $3 million, $4 million on homicides in this community. That is direct tax base. That is not state dollars. That is like a local tax base. So that's really important. It's also important to place law enforcement within that prevention, intervention, and aftercare model, because I think people believe in their mind, when they support law enforcement, that it is preventing something. And they can argue that all day long. But at the end of the day, the scope of practice of law enforcement is not to prevent. They can't arrest you because they think you're going to do something. They can only intervene when the law is broken, when somebody gets shot, somebody gets injured, somebody gets threatened. And that's typically what happens. So it's important to place it, because I think that a lot of elected officials don't realize that what they're investing in is not the preventative aspect of this work. So that prevention, intervention, aftercare model is really important, because what it helps you understand is that most of your investment in communities is only going to be on the intervention side. And that doesn't do anything to address the root cause piece or the prevention. And then what services do we have for communities that are impacted on the back end or survivors? The other important aspect that, again, is well within the control, that I think is underutilized, as we said earlier, is the aspect of tracing firearm data. We really need to ask ourselves a question: why young Black and brown people have such easy access to illegal firearms, and other communities do not? Because while it is a tragedy that young people are picking up firearms and taking their own lives or the lives of others, the real tragedy and the controllable variable is, we need to ask ourselves, why is it that these guns are so available in our communities? And where are the guns coming from? And in California, we have the technology, and the data does exist to track this information. Law enforcement has the ability to do so. Whether they choose to do or not is a different issue, but this is a significant area that, if we were to look at some of this information and trace where these guns are coming from, it becomes manageable. And let me give you an example of what that is. I know we're getting close to time here. In Oakland, we're working on a project right now with Brady United. I think Greg is on here. He's a wonderful partner. And we're trying to track guns that are found in crime scenes in Oakland. And in a significant number, something like 30, I can't remember what year it was, but were identified from coming from the neighboring town of Martinez, and potentially 1 or 2 gun stores in Martinez. That data is very important, because then city councils can work with each other to say, hey, why are these guns appearing in our community? Because they're not just magically you know, it's not one person. It's not the same person that got arrested 30 times. It's probably one or two people that bought those 30 guns, trafficked them over there. And now you can begin to put pressure on those gun owners or gun storefronts to begin to figure out how they're going to fix that because they're not doing something right, or possibly pull a business permit. And why that's important is that what the data is telling us is that 5 to 10% of gun stores in the United States are responsible for 90% of crime guns. I'm going to let that sink in because that makes it very manageable. That means that 90% of gun dealers are doing the right thing. They're not selling when they understand that somebody might be trafficking, but 5 to 10% are. And that 5-10% are responsible for a lot of what we're seeing in communities across the country. So it's important to track the data. And we recognize that some of these guns are coming from out of state, but you'd be surprised once you start tracking the data, what you find in terms of the proximity from one community to another within California that are being sold. I think it's also important for us to talk a little bit more in our communities and our organizations around safe storage, providing safe storage information, especially in multiple languages, providing gun locks for people. There are many communities that have firearms. They may be legal or illegal. I grew up in a gun owning family. They were primarily unsecured, and I had access. And so this is an important aspect of the work. We're not questioning whether people should own or whether or not they're legal or illegal, but we do want people to understand that there is a risk associated with unsecured firearms, and we need to make sure that they're stored in terms of homicides, but also in terms of suicides when people are not feeling at their best. Again, safe storage information language is also critical because in 80% of school shootings, in 80% of the cases, the shooter acquired their gun in the home, which means that if it was a young person, that firearm was unsecured and they should have never had access. So that becomes another big area for us to advocate in, that we can kind of move the work forward to make sure schools are providing that information or our organizations are providing that information, and the importance of securing firearms. The last thing I'll end with is public health and mental health system advocacy. Again, for a lot of us who intersect with mental health a lot and public health, we need to push those systems to screen and ask whether or not people have and own firearms and whether or not they're secured, so they too can provide safe storage and crisis planning that works, especially in mental health. Most people are surprised to know that mental health currently does not screen throughout its system whether or not somebody who is mentally ill and might be suicidal at different times in their life because of their diagnosis. They currently do not screen for gun ownership or whether or not there is a gun in the home that they have access to. So with that, I'll stop. I think that was it. Right down to the wire, but I know we do have a few minutes if people have any questions. Again, want to thank all of you. This was kind of an opportunity for us to showcase kind of what the toolkit looks like a intro to gun violence and areas and practical strategies for organizations to look at integrating some of this work and how to address some of this work in your own community. It's also intended for community members because, again, as it's one thing we work in organizations, but in our own communities as citizens, we have the right, and now we provided you hopefully with some strategies to show up in some of these spaces where electeds are to say, hey, we have some solutions, we have some questions. Why is this happening in our community? So let's see, I'll check the Q&A, see if there's any questions. We don't have anything. So, okay.
Nothing there. We'll begin.
Anything else, Brian or Saul, before we let everybody go?
I just want to remind everyone, we'll be sending some of this information out to those of you that registered and attended. And Kuko shared his information, which we're always here you can reach out to us and we'll walk you through this information. It was a lot of information in an hour. We could probably share double that information, but we want to be very mindful of time and what we share with you. But these are very important.
When we package the toolkit, we'll finalize it. We will forward it on to everybody. It would be basically a summary of a lot of what we discussed, more of a practical user guide for everybody to look at.
And as we're signing off, thank you, Coco, for that. I do want to acknowledge our executive director, Brian, who's with us and started us off today, and his 30 years in the movement of firearm violence prevention and his work. And so, I don't, Brian, any closing thoughts before we sign off? And
No, no, this is great work, really important, and really appreciate everybody attending today. And Kuko, thank you for moving through a lot of information in a very succinct and efficient way. So thank you.